Leslie Branch. Welcome to our virtual open house. Thanks so much for joining us. We're just going to talk a little bit about some things that might interest you post-baby. And we've got 4 little boys between us.
So we want to kind of hit all the things that start with a B today. So that's Botox, breast reductions, and body after baby. All things which are great options to kind of rejuvenate your body with being a young mom or being done with having children and all the changes your body has gone through. Starting with Botox, after you finish breastfeeding, after babies, it is a safe time to start your Botox again. All the stress and the wrinkles that you can get from being up late at night, Botox can melt these wrinkles away on your forehead. So it is an easy treatment, no downtime, and a great time, especially getting into the holiday season and fall, to start this.
I think Botox is great. It's easy to do and fit into your schedule, and I think that it's something small you can do. I think sometimes Botox may get a bad reputation about freezing your face. You're still gonna look like you. You're just gonna be refreshed, which is awesome. It does help smooth out the forehead and the little crow's feet lines that you can get, and I just think it's great.
And I've had mine done. It's probably been a month or 2, but I can still move my face. I can still raise my eyebrows, and you see as many of the crow's feet and kind of in between your brows. So we really cater it to you. So it doesn't have to be a set amount. It can be a different amount of units. We place it a different way depending on your face and the results that you want.
Oh, you go ahead. So we're also going to talk about body after baby. We know more than anyone that your body will change after you have a baby. And thinking about maybe having a surgery like a breast reduction, breast lift, a belly surgery after you're done having babies, do something for you. I think it's great.
Yeah, you've put a lot of effort and time into growing these children, feeding them, making sure they're safe and healthy, and sometimes it's a nice rejuvenation to feel like yourself again, to give yourself the confidence of your body back after it's gone through all these changes.
Surgery here at Plastic Surgery Center is catered towards you. Patient safety is number 1, and patient privacy number 1. So the winter months, fall, winter months, before we get into next spring and summer, great time to devote some time for yourself. Maybe have a little surgery, recuperate, and you'll be ready to rock and roll by summer, spring of next year.
And a lot of moms feel like, oh, I feel guilty doing this, whether I'm putting, my life at risk for a surgery and I have young children. But these are very safe surgeries, and we're all board certified plastic surgeons here. We make sure that everything we do here is safe, it's up to code. We have a certified OR, and so what we're doing is going to be the best for you, and to really kind of just like give you that confidence back. It is worth it, but we're not going to do anything obviously to harm you. It should only improve kind of your life and your body.
I can't tell you how many patients we've had that said, I have been waiting to do this since my son went to high school, or since my son was born 40 years ago. You don't have to wait 40 years. You can come and see us sooner than that.
And a lot of people say, yeah, I wish I'd done this 20 years ago, knowing the results they got and how much better they feel, not just emotionally, but also physically, like having, the large breasts or the extra skin, getting that weight off of your back and your neck feels so much better. And then for your belly, the same thing, tightening those muscles that have been stretched out helps relieve the back pain and the pressure off your back. And so it can just physically improve your life as well. With my nurse Brittni, and we are talking about Botox, breast reductions, and your body after baby.
All the B's with Branch and Brittni.
So Brittni, you can kind of tell us what, as far as your breasts and changes after nursing, what do most people kind of complain about?
So after having a baby and feeding these children, your breasts will never look the same. But that's okay, because people like Dr. Ranch, you can come in. So typically words are thrown around like breast reduction versus breast lift or mastopexy. They are similar in the techniques of how they are done. Breast reduction is going to, as it sounds, make your breast smaller. And we cater that towards you and your body type. Breast lift, say for instance, you've nursed a baby or two and you have some extra skin, that's gonna help raise everything back up to where it needs to be, where you want it to be, to where you look good in your t-shirts and bathing suits. Again, both procedures are very similar, but both are gonna give you that lift back up to where they were before you had babies.
Yeah, so both procedures, like you said, will lift the breast. One just means we can make them a little smaller, and both also reshape the breast. Mm-hmm. It'll give you a rounder look, a lifted look, and a more proportional look to your frames as far as fitting in clothes and filling out bras or swimsuits. That'll feel much better without being much bigger in a sense. And I know Dr. Lawson will talk about implants later, and that's another option as well, but you don't need an implant, especially if you don't want one, to reshape the breast and lift it and kind of fill it out up top.
So after having a surgery, for instance, a breast reduction, a lift, or a tummy tuck, you're going to need a couple of weeks to recover, which I'm just gonna say it as a mom, 2 weeks off to recover, thank you, it's like a vacation for me. You can rely on family to help you during this time, you know, grandparents, everybody can pitch in. You're gonna feel like yourself, you're just gonna be more tired, maybe move a little slower, and need some help lifting those babies, but you will recover in within a 2-week window, and you'll make it work.
And most women do great. I mean, having been through childbirth and things, you know, the recovery is not as bad. It's just almost forcing yourself to slow down for a little bit while you heal. So again, it's the first week or two are always the hardest, but then that's when kind of you get some help. Mm-hmm. And just kind of be careful how much you're lifting. But after you hit that 2 or 3 week mark, you're definitely already kind of moving and perking up and kind of getting your life back to normal.
All right, so we are here ready and wanting to answer your questions. If you have anything to ask us, you can type it in the chat box. If you would like it to be private, that's okay. And if you'd like us to address it to everyone, we can do that too.
And I feel like if you are having a hard time deciding whether or not to come in, I think the hardest part is getting here. And when people, you know, have the heart to make the decision, it's hard to come here and talk about these sensitive subjects and sensitive part of the body. But honestly, when everyone gets here, they're so happy they've had the consult and they are ready to go. They're ready to have the surgery the next day because they're excited about it. But we do this all every day. This is, you know, what we're comfortable with, and we make you comfortable throughout the process. So please feel free to make a consultation to discuss anything further.
So another thing I wanted to mention was, if you are not wanting to kind of make that leap and go straight to surgery, maybe you don't need to have surgery. There's something that can be done that's less invasive. I know personally, C-section mom, you know, no matter what size you are, there might be a little shelf there that you're not happy with. We have options like cool sculpting and cool tone that can really help make you see a difference, especially if you've got an event coming up where you're gonna be in a tight dress, or you're going on vacation with the hubs after 10 years and you wanna look good. Definitely talk to Kinsley and Gina at the Vista and ask them some questions about the cool tone and cool sculpting, which can be a great non-invasive option.
And some other non-surgical things as far as changes after baby. Your hair, you know, with your hair, it'll get thick, but then it'll fall out and you're worried, is it gonna come back? Well, Nutrafol is a great natural supplement. I know one of our nurses here, after her first boy, really struggled with that and has noticed a huge difference as far as taking these Nutrafol supplements. So again, our estheticians here can kind of guide you through kind of that route and kind of do the different options we have. And another thing is your skin. So there's some skin changes. You know, you might feel like your skin is great in pregnancy, but then afterwards with the hormones, you might have more acne or changes or more dark spots, kind of the melasma from the sun. So there are lots of kind of medical grade skin creams that we have here that can also help with that as well. And I know they'll be talking a little bit more about this later, about some of our Obagi products, but watching that session, it kind of made me think about, well, maybe this is a great option for me after kids. So one option, the Obagi skincare is great as far as kind of treating that, the pigmentation and the melasma. It is honestly the best thing out there to really smooth the whole texture and color of your face. but also this great new thing for your brows and your eyelashes, where they used to have the lattice. The lattice would make my eyelids kind of red and irritated. Even the benefit is, yes, your eyelashes grow a little bit longer, but you have this kind of redness for a few days. Well, the Abaju one doesn't seem to have that side effect, so it's very easy to use more often. You just apply it right under your eye, above your eyelashes here once a day, but they also have one for your brows, which is amazing to kind of help fill in your brows, darken it. I know they're already darker to start, but I've already noticed a difference after a week of kind of using this product. Something very easy that you can use, and something you can do every day or every couple days at your convenience.
It's exciting and it works. And if you plucked your eyebrows when you were younger, like the rest of us did, and you're a little thin, then yes, it really does help. And having to have eyelashes that are long and full, and you're not having to worry about getting lash extensions or putting on like 8 coats of mascara, the new Seal is really great to use. So the estheticians at the Vista, our med spa, Kinsley and Gina, when you come in for a treatment, they will make you feel like a princess. I have had some Diamond Glow treatments before. It's great for any skin type. You come in, and if you just want to take an hour and relax in a darkened room, nice music, and they're just working magic on your skin, it's so wonderful to be able to come in and do that.
Yes, it definitely caters to that kind of spa experience, very relaxed, being treated, like I said, feeling like you're a princess, with getting medical grade results is a nice plus. So you're paying, the same price you might at a spa, but you're using much stronger treatments that are going to see a much more significant result. And I've had multiple of my friends say, I've done the Diamond Glow at your office and it's so much better than other places I've been. So it's nice to hear, but I think that also caters to how great our estheticians are here.
All right, well, thanks for joining us. We'll be here all day until 5 o'clock. If you have any questions at all throughout any of these videos, you can certainly put it in the chat box. And as a reminder, we have an awesome sale on all of our products. I believe
Yes, it's 20% off all of our skin products. This is the best sale of the year. You can get it on anything. You can buy it online. It's very easy. We can ship it to you, or you can come here and we'll deliver it to your car. So whatever works for you.